Hey everybody, good morning.
Morning.
We are so happy to come to you for our next live event, and we have the pleasure of speaking with Stephanie Ravalese. She has the coolest last name,
She
doesn't
does
she?
have a cool name.
And we're going to be talking about women's health and getting women back to fitness after they've recovered from having children.
Yeah.
Hey Steph, good morning. Here we go. Let's get her in. Boom, boom, boom. Biggest ad that we've ever had here. Let's.
I would say
Not gonna
limes are not
let. Not my
either of our
forte.
specialties at all. We're usually spending 10
Hi.
minutes to do it.
Steph, good morning.
Good morning.
We owe you a big coffee because we're out in New York and you are all the way over in California, so
Yeah,
small time difference.
I know. Yeah, still dark out.
Oh my gosh.
Cheers, cheers. We're
Yeah,
gonna send you a definitely a virtual coffee coming your way.
nice.
How are you doing?
I'm good. Good. Came back from my vacation on the East Coast, settling back into work.
Nice, nice. How was
Yeah,
vacation?
it was great. I saw my family. I did something different, like all 9 days long. So
It's
yeah,
fantastic.
yeah,
And we were just out in Texas and then just came back to East Coast. So
nice. Yeah, yeah,
yeah.
Yep.
yeah.
It was too hot out there though.
Yeah.
I wouldn't recommend it in June ever.
It's a
No,
heat
yeah.
index of 105. I don't know how they do it.
I
I
know.
don't.
Yeah, I
Yeah.
used to I used to live in Texas, and this is definitely a hot, hot time of the year.
Yeah, yeah, for sure. And well, we wanted to take a little bit of time and just kind of get to know you a little bit before we kind of get into this talk about how we break that stimulus or not the stimulus, how we break the what am I looking for there? Words.
It's not early here.
Not that cliche that women are just going to bounce back from giving birth and get back to health and fitness, which is what you and Amber both specialize in. So, tell us a little bit about yourself before we jump into that.
Yeah, so I've been a PT for about 4.5 years, mostly working in like outpatient orthopedics, like various, things with that. And the last 6 months, I decided to switch to women's health. For a lot of different reasons why, I just love working with women. I think it's really an important field to work in because I don't think that women have enough support. And I think it's just really important to, take care of parents during this time and a huge life change of having a baby and having a kid.
Yeah.
And
In COVID too. Like a lot of moms
yeah,
just, I mean, I feel like had stopped taking care of themselves because their kids have now had to go to school via,
yeah,
tele and like they're all home and so the mom doesn't have any time now.
Yeah.
right. Yeah, yeah,
Yeah.
for sure. Um, so I got my bachelor's at UMass Amherst. I went to PT school at University of St. Augustine in Austin, as my educational background. And the biggest thing about women's health that I think is important is that not enough people get referred to pelvic floor PT or and don't know how to do, managing incontinence, peeing when also known as peeing when you sneeze or jump or running,
Yeah.
um, and just a lot of other things like back pain, pelvic pain. It's all just people can feel like they have to live with that, but they don't. So it needs a lot of outreach.
Yeah,
Yeah.
and even
Yeah.
I get a lot of patients and clients saying, "Oh, well, you can do that as a PT." Like most people don't even know that there's an option, let alone how to deal with it.
Right.
Yeah.
Oh, it's great. Stigma was the word you were looking for.
Stigma. There we go. There's
It
a
just came to me.
stigma around
Yeah,
it.
there's a stigma. Yeah. Yeah, so I think that's huge because even during our schooling, I mean, we went through 2 days of pelvic floor.
If
Not
that.
even. I mean,
If
it wasn't
that.
even a thing.
Yeah,
Yeah.
we had one lecture.
Yeah.
So,
Yeah.
yeah.
And then I went to a Herman and Wallace course and I'm like, whoa. Like my mind was blown because I'm like, there's all this stuff that we can do. And,
Yeah.
it's crazy.
Yeah.
Hmm.
And just so many things affect pelvic floor. I mean, um, with, the way the insurance model usually works, you can only treat one body part at the same time, but just like, you know, if you have swallowing difficulties, that can affect the pelvic floor, like just so many things, so many
Yeah.
things. And so that was something cool that I learned as well.
Yeah.
Yeah.
Even people with breathing difficulties, COPD or people that are high anxiety and stress, like your breathing has a huge, huge impact on your pelvic floor. And again, people don't really realize that.
Yeah.
Yeah. Yeah,
And
for
if you
sure.
go with the insurance model, outside of COPD or asthma, there's really not any diagnostic codes that are able to be applied. So insurance is going to say, "Ah, this isn't a thing."
Hmm.
And so for that reason, cash pay, looking outside the box, not thinking the traditional model, may make sense for a
Mhm.
lot of people when you find a practitioner who looks at you as a complete person.
Yeah, that's very hard to do as in the insurance-based model, but
We
which
don't like that.
yeah, which stinks because most people think that that's like the accessible thing. They think that their insurance is going to help them a lot, but really, breaking out of that gives people the element of choice, so
Mhm.
much more freedom, for both the clinician and the patient, and better outcomes. So,
Right, right.
Yeah. Who specifically do you work with or do you enjoy working with?
yeah, so I work with pregnant and postpartum women who want to get back to exercise or continue an exercise routine during that time. I like working with, people who like to be active, specifically with strength training and weightlifters.
Hmm.
Um, I think strength training is hugely important, and it's something that's a lot of very misunderstood within this population too, because people think that they, either can't or they've received just a lot of varying advice about, don't lift over 20 pounds, which is super generic, and the ACOG doesn't even recommend that anymore. But it takes a lot, for current research to catch up and be into practice.
Right,
Mhm.
right.
Yeah. And so it just has so many benefits, but with how much varying advice there is, um, and the fact that you really need individualized recommendations, it's just, yeah, it's hard to navigate.
I feel like two patients aren't even really given a direction right out of the gate. I mean, I know after I delivered, I didn't have many complications, but I mean, they're like, okay, nothing for, 4 to 6 weeks. And
Good luck.
I mean, I remember going to the gym like a week later and I was like, I'll try the treadmill. And I mean, even me as a PT, like, I was unsure of what my body was ready for. So I was given no direction
Hmm.
towards that at all.
Yeah, and I
So,
hear that a lot because you have a bunch of prenatal appointments, but postpartum you have 6 weeks and then you're just cut
yeah,
loose. Um,
yeah.
yeah, and so people definitely need help and direction with like managing symptoms, and then also like the realization that your body created a human being over the last 9 months, and it's fine for there to be a lot of changes. I think another huge thing is making sure that my clients know that and be comfortable with the fact that your body will change and it's okay.
Mhm.
um, a lot of
Yeah.
people get hung up on just like, oh, why can't I used to do this, this, this? Why can't I do this? So it's like, you went through an entirely huge change in the last 9 months. And so kind of more emphasis on respecting the healing process and like just,
Yeah.
being okay with the healing process without the pressure to just go back to what you were doing.
Yeah.
Mhm.
Yeah. I think that's really important.
Yeah, that's huge. And then you're also worried about like if you are a new mother, like worried about keeping the child alive at that point in time. And so your own health kind of, goes out the door a little bit because you've just taken on this whole new role. And so that's difficult.
Yeah, exactly. It's like, and then there's certain things that you can't change, like, sleeping. New parents don't have a lot of sleep, and there isn't much that you can do in terms of that. And so it's also like teaching people how to like mitigate and navigate these huge life changes while all making time for yourself. And then even if that's 5 minutes a day at first, then that's fine. It's 5 minutes a day. And then you can just go up from there as, your your kid grows and changes over the months and stuff like that, and things get different. So
Yeah.
Yeah, yeah, for sure. And then even knowing too, like what's normal and what's not. Because again, as a first-time mother, like you said, your body's making these crazy changes, and you hear that, oh, well, leakage is normal, like you just had a baby. Is it like normal or is it common? And I
yeah,
think people just end up putting their health on the back burner because they're like, oh, well, this is normal, like it will go away.
Right.
Yeah,
So
I definitely think the word normal and common are used interchangeably when they shouldn't be. Because, people usually associate, and even me sometimes too, like associate normalized with like, oh, okay, well, I guess this is okay. But I think
Hmm.
common is, a little bit better to use because then it's like people will know that this isn't something that they have to live with, like it can change.
Exactly.
yeah.
Yeah, for sure. That's
And
huge. Because I remember
yeah.
even asking you at some point, I was like, is this normal? Like, should and me as a new mother too, like I had incontinence issues and they lasted for months and I just was waiting for them to go away before I really got into pelvic health stuff. I was like, oh, it'll go away. And then like 6 months later, it still hadn't, which caused me to finally take action because I'm like, oh, this is a long time. Like I didn't just have a baby anymore.
Right.
She's
Yeah.
almost 8 months. She's almost a year old. Like
She's
that's
almost just
not,
crawling, away from
yeah,
us, and yeah,
yeah.
at that
So,
point,
Yeah, and I think it's also too to get people used to, like the peaks and valleys of recovery, that sometimes
mhm.
incontinence can come and go. Sometimes, symptoms of prolapse, which would be like, heaviness and stuff like that, it can come and go. I know somebody that has a 2-year-old kid that all of a sudden started getting prolapse symptoms again when they first had it after um, a kid. So, like any injury, you might just have to reset and come back to it every once in a
Mhm.
while, and knowing that that's okay.
Yeah, and then knowing what to do to then help it.
Right.
yeah,
Yeah.
I think that's the big thing is having an action plan for if those symptoms come back, what do we do?
Yeah.
We do that a lot with our clients who have chronic back pain and severe back pain injuries. We got to have that fire safe plan to really know exactly, okay, I'm feeling symptoms. I know exactly my A, B, and C. We're going to knock this out quickly and make it a bump in the road rather
Yeah.
than this huge setback.
Well, because then it decreases, the anxiety behind it. Oh
Hmm.
no, like I just re-injured it. Okay, wait, I actually have steps that I can do to alleviate it. So I
Hmm.
think that's huge mentally.
Yeah,
That someone feels like they have control
yeah.
over their injury,
Take that power back from the injury and don't let it rule your
Yeah.
life then. And oh, I guess I'll call up the doctor now. Oh, I guess I'll wait for an appointment. Whatever they say, this is normal.
Yeah.
That kind of answer. So
Yeah,
Hmm.
that's why I think like as healthcare professionals, it's so important to like watch how you talk to people and be somebody that is like approachable, and you empower your client to have confidence so that if that does happen, there isn't necessarily like a fear-based reaction. They can just reach out to you and ask, and it's like you're that
Hmm.
person that helps them, feel driven and motivated and confident, and like they can
Yeah.
have control. Um, and so I feel like it's definitely important as, PTs, other healthcare practitioners to know that like you can be a big deal in people's lives.
Hmm.
yeah,
And
Yeah.
sometimes it's weird thinking about that because working with people is so normal, but we can really make a huge difference and have a huge impact. And so the way that we educate people is like probably almost more important than the interventions that we do.
Hmm.
I completely agree.
Yeah.
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 Exactly. And so do you have a specific certification for what you do for like the weightlifting with pregnant women or?
Yeah, so I have a pre and postpartum strength training certification that I went through to just give a little bit more, education for me on how to work exercise programs, different changes, things to look for as people progress through their pregnancy and how to make accommodations for that.
Yeah.
It's very
Yeah.
cool. It's very
Yeah.
cool.
And so do you see your clients digitally?
Yep, digitally. So what it is for that is I, make up exercise program individualized. We talk about goals, everything like that. Make up their program for however often they want to start out at, and I provide a couple different check-ins, one little informal check-in and then one formal video check-in for people. Um, that way that they and then just progress and direct them and make sure that all their questions are answered and everything like that. So they get a lot of support. And there's a lot of flexibility for them too. There's no driving. I mean, I live in LA, like, no traffic. You can just do it at the
Yeah.
comfort of your house whenever you want to, because, with making appointments, it's like you have to commit to a certain time, and, with digital, you don't.
Mhm.
You don't have to worry about anyone watching your kid necessarily, and so it kind of takes out a lot of the um, probably like hectic things that could come with having to go in person,
I think
especially
that's super important too,
yeah,
just with, I mean, people who are pregnant, they have enough appointments to be going to. And then after you have
yeah,
a child, yeah, you're right. Then you don't want to be bringing the baby with you to, your sessions.
Yeah.
So it's hard to
Try
get out of the house with a
yeah.
child.
Trying to schedule anything around naps and the unpredictability of that is ridiculously hard.
Yeah.
yeah,
Especially when they sleep 5 times a day. There's no
yeah,
time.
yeah. Especially with the pandemic, I just like digital is the new wave.
Mhm.
And I think it's so helpful just to provide the flexibility too, because you might not get to have like one session of doing a workout, in one go, but with the digital format, I mean, you can do, if you did it a 10-minute chunk at a certain part of the day, you can do another different, chunk, working around your kid's schedule and your schedule and stuff like that. So,
Mhm.
yeah,
Yeah.
I think it's a really cool option for a lot of people. One of the good things that came out of this pandemic. So,
Yeah, really spurred along the idea of digital
I think it
healthcare,
gave,
right?
yeah, more people options
yeah,
just for healthcare in general. I mean, yeah,
Hmm.
I think it's
yeah,
great.
yeah.
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 Um, what is it that you see like the one of the biggest complications when you're trying to get a woman to take ownership of her injury and then move past that postpartum kind of self or the prepartum self into the postpartum self. And yeah, I'll stop there.
Yeah, well, again, a lot of it stems from not a lot of OBs and midwives refer to pelvic floor physical therapy. It's not utilized as much, and so I feel like if it is, there would just be a lot. It would be a lot easier recovery wise. Expectations would be a lot more realistic. Um,
Hmm.
I think a societal shift is huge too, having people that talk about this. Because a lot of people will take advice from, their mom or their aunt or their friend or everybody else and just pick and choose, which everybody is so different.
Right.
And again, with like the outdated, you know, advice, and there's so much advice out there, but there's also so much um, you know, it's hard to do research when it comes to exercise in pregnant women as well. And so it's hard to really navigate with the guidelines and stuff. And so I just feel like if there was a lot more streamlined recommendations, more professionals getting out there and giving people advice, then it would have a little bit better of an expectations versus reality effect.
Yeah.
Yeah, it might decrease like the Googling too, like people are doing, like just how do I do this? What do I do for this?
Yeah, I mean the internet's a powerful tool, but yeah, I mean I've had all types of my patients, Googling and stuff, but and I mean it's great that we have that information out there, but again, it's like it's just so generic,
Mhm.
and that's why talking to a professional to really hash out what do you need as an individual is huge.
Yeah.
Yeah.
Yeah, for sure. And I had learned too, just when I got into pelvic health, so over in France, they actually get 10 to 20 sessions women immediately do after giving birth, regardless of if they've had complications or not. And that's like a normal
It's a
thing
standard.
over, yeah, on the eastern side. So I wonder like if we'll ever make the shift to that or,
Yeah,
it's
whereas my
crazy.
mother's an OBG here in Houston, and we still don't talk about it, like you said. So we need to go a long ways from where we are now.
Yeah, Europe is quite ahead of us in that aspect, maternity leave aspect, just more
Mhm.
support. The US has a lot of work to do with their healthcare system, one, providing support for parents and, women in general. Um, I had a colleague working at a hospital network where a lot of men got referred to physical therapy. They had all men. And so that really needs, I mean, that's interesting to see. And so, the US needs to care a lot more about women's health. I think it has to do a lot with accessibility of healthcare. Hopefully someday we'll have universal health care. I'm a huge proponent of that because it's just going to increase access for a lot of people.
Yeah.
Yeah. And I think too, like pelvic health is kind of like we're kind of zebras in that whole society because the town we live in, we have one pelvic floor therapist. She works at the hospital and she only takes women because she's the only one there and she's so full every day. I mean, and she can only see people maybe once a month, maybe. She's so busy. She's so busy.
And so if she won't take guys, then they have to drive, but
I don't even
beyond
know.
guys, like we don't go to healthcare in general.
Yeah.
Guys are so much more reserved when it comes to asking for help. And, especially in an area like that, um, where it's kind of tied to our manliness. I can only imagine how hard it
Stubbornness
is.
is what it is.
Stubborn, maybe.
Yeah.
I
What it
won't,
is.
I won't fight that.
Mhm.
But then to drive that extra 45 minutes for an appointment, I can only imagine how many men in this area are not being seen for a problem that could be helped.
Yeah.
Yeah, for sure.
Yeah.
So tough, tough. Um, well, I think that incontinence is one of those big issues. And Carla had a question, not with incontinence necessarily, but really feeling like she had to go to the bathroom when she ran, even if she even if she didn't actually have to go. And so if I remember correctly, she was getting to like 3, 4, 5 miles. And right about that 4 mile mark consistently on longer runs, she was feeling like she had to pull off into the woods and go to the bathroom. Do you guys have some insight on that? What might be going on?
Well, I think for her, she had said at like mile 4 specifically, like every time she ran, like at mile 4, she had to go to the bathroom. And so I haven't seen Carla. I haven't talked more about it with her. I mean, to me, I would do like a bladder diary and like look at her habits. Because it seems specifically if you have to go at like that certain mile every time, then that's like an unpictured thing.
What's a bladder diary?
So basically it's like a log, and every day it's a chart, and you've got your times laid out and your days, and you're essentially writing, what you're drinking, when you're urinating. I like to even include food on it too, like because there's a lot of bladder irritants just from the food you eat. So from there we can kind of get a general idea of, okay, are you going to the bathroom when you need to? Are you doing those like just in case bathroom breaks. So there's a lot you can find out from a bladder diary. Are people going during the nighttime? There's a lot of things you can tell from it, but it helps us to tell people's habits. And I don't know if you use those at all with your clients.
Yeah, I do. And I think it's really important to habit track too, because there's just a lot of irritants like coffee. Um, you know,
So delicious.
yeah, and there's so many reasons why this can happen. I mean, maybe, you're drinking coffee in the first, when you first wake up instead of some water, and a lot of people recommend, do a glass of water um, before you drink coffee. And there's a lot of different reasons um, why you could have those types of symptoms, feeling like you're going to pee even when you're not. It's best to get evaluated so that way the person that way for sure. Um, so
Yeah, it's one of those things that it's hard because I try to explain to Nick, well, sometimes when people have those hypertonic muscles, then that does create urgency and they have to go more, but there's a lot of variables because you could, like, for my instance, when after I had Charlie, I had a lot of incontinence, but so my pelvic floor muscles were tight. And so I had to be lengthened first before I was then strengthened.
right,
And so that's something you wouldn't really know without an evaluation. Everyone automatically thinks, oh, incontinence, oh, we need to just strengthen, strengthen, strengthen. But if your muscles are already short, I mean, that's not really helping the matter. So there's so
right,
many variables in there.
right,
And one of the reasons that matters is because short muscles are not necessarily strong muscles.
Right.
If you think about a rubber band, right, you really are going to get more force out of that rubber band. Say you want to flick a piece of paper or something across the room, you're going to really lengthen that rubber band so that it shoots and has more force, right? Whereas if you can only move it this far, that piece of paper isn't going to go very far. So
Mm-hmm.
by lengthening,
Good ortho analogy.
but by lengthening, we don't necessarily mean, especially when we talk about the pelvic floor, stretching necessarily,
Mm-hmm.
but really understanding how to control those muscles more appropriately,
Mm-hmm.
and then add that to your daily life, right? And then that would make
Yeah, because just like any other muscle with the pelvic floor, you have to learn how to coordinate it too. So even once it is strong enough, then coordinating it at specific times is also super important, like any other muscle in your body. But for her, yeah, for Carla, it's kind of hard to say because we don't know, what she's drinking before, when's the last time she went to the bathroom before that mile 4, or I think there's other questions that I would want to ask her.
For sure. Yeah. Another thing too is if you're not able to get that contract and relax, which a lot of people probably don't know because you always think like, oh, I just need to do a million Kegels, pelvic floor exercises, Kegels. But then that gets into, the whole thing where people just they constantly think they need to strengthen. But if you can't relax your ab muscles and get that, like contracting the relaxing and the, contracting and coordinating that, holding your ab muscles, especially very tense, can bear down on the pelvic floor. And so that's another possibility as well. And then, so being able to do that and then also being able to apply that to your activity. It's like a 2-step process.
that's the big
Yeah,
thing.
so breathing and mechanics, and there's a
Adding it to
lot.
function.
Yeah, there's a lot to do with that for sure.
Mm-hmm.
Yeah. Do you also like with your clients, do you ever talk about painful sex, or does that come up to you, especially like after pregnancy? Is that something that you come across?
Yeah, it is something that I definitely come across. And, again, like, the contract and the relax, especially being able to relax. Sure, after a kid, the prospect of having sex is kind of scary for a lot of people. So again, being able to do the whole kind of contract and relax, but especially relax, is something that definitely comes up.
Yeah, because even your doctors don't really, they give you I don't even know what it is, 8 weeks, 6 weeks.
No sex for 6 weeks.
Yeah, and they're like, oh, you'll be good to go. And then you're just like scared to death.
What's going to happen here?
Yeah. Well, again, you just, delivered a child. So
and I don't know this, but do you guys know of maybe other like qualifiers? Like when I'm talking with clients with back pain, like if we want to get to, say, back to running, I have check marks, for them to be able to accomplish so that I know that running is going to be able to be handled appropriately and without a setback. Do you all have kind of a similar idea of what needs to be able to be accomplished to be able to have sex safely or without pain? Like, are there those benchmarks?
I mean, essentially, and you can tell me what you think too, Steph, but like a lot of times you start working off smaller. So, I mean, there's a matter of, can someone put in a tampon comfortably? I mean, that sometimes is a good start. But then there's also, the dilator therapy, and I don't know if you use that at all, but
Yeah.
There's dilators, size 1 through 10, and they basically start the size of your pinky, and you can kind of start there to start acclimating your tissues and kind of work yourself up from there. But other than trial and error and actually having sex, I guess you might not know before that how it's going to feel. So then after you do, you can always go back and kind of work yourself into it.
Yeah, I mean, I think dilators are really, really helpful. Using like, a tampon as a gauge too is really helpful as well. And then again, I think that a 6-week recommendation is kind of arbitrary because it just depends on, does somebody that had a relatively uncomplicated birth and didn't tear or anything like that, could they do that sooner than 6 weeks? Possibly. Or, somebody that has a grade 4, has a lot of different, stitches, maybe scar tissue, things to work off of. Are they going to be ready after 6 weeks? Maybe not. So again, it just kind of goes, the guidance of a professional is so important. Yeah, it can help decrease a lot of anxiety.
Yeah, like, I mean, people can even just have pain externally around that area. And so that's a good marker too. If you can't really take touch or anything around that area, then that's probably a good indicator that, you may not be ready for penetration or insertion of anything.
Oh, I
Yeah.
guess that's a really
Because
good
there's
idea.
different points of pain. We ask, well, where are you feeling the pain? At the point of insertion, once, you've already been penetrated, because there's different levels of muscles there.
Mhm.
So I think that really depends too.
Yep.
But yeah, and again, just to let women know it's something they don't have to deal with.
Yeah.
I mean, yes, it's tough in the beginning, but you can learn how to acclimate yourself into that. So, you can enjoy yourself again.
Yeah.
And from a husband's standpoint, like we want to know how to support our wives best. Like
Aw.
I do, and but there again, there's no guidelines for that because as we go to these appointments and stuff, like I'm hearing that 6 week mark, but I don't know what I can do to help that along,
And then they're
other
like,
than having
are
fear
you
myself.
depressed? Answer the questionnaire. Are you depressed?
Maybe for 6 weeks, I don't know.
Yes, I'm trying to keep a child alive. Like, I don't know.
There's
You don't even hit that in your postpartum. And maybe some people have, but like, I know my postpartum, it was like, okay, how's the baby? How are you? Great,
hmm
get out of the office. Like, it was just,
Yeah, everybody
I got no
okay, see you later.
information.
Yeah.
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 And it stinks too because, doctors are constantly being like crammed with more patients, and so the amount of time they have to answer questions gets shorter and shorter. Um, but I would think too that, sometimes people end up relaying information to their husbands, but, I'm open to, if your husband wants, pointers and if he wants to know any information about what we've been doing, how to best support you, like reach out to me via email. Totally cool with talking to husbands and kind of teaching them how they can best support their wives. I think that especially if their interest is there and they want to know, and so they're really intrigued, that'll make like a pretty productive conversation.
Yeah.
Because when, I mean, when you have a kid, it's really a team effort, and so I think that husbands definitely need to be included in that.
Yeah.
Yeah.
Yeah. And even before, just so you know, like before you have the baby, it would be super important just so you know what to kind of expect. And yeah, because I think you're just kind of blindsided.
It's a big deal. No matter how much we
Yeah.
read, I tell you, I was listening to podcasts, I was reading books. We were talking about our
Yeah.
game plan.
You can't really prepare for the baby, but like I feel
About
like
the
you
water.
might be able to prepare for yourself though, and maybe a little bit of what you're gonna go through and I even took like prenatal classes, like we went to the hospital and learned how to breathe and do all that kind of stuff, but I don't know. There's like a missing link
And I would
of
say they were really good classes too. We went for eight
they
weeks,
were.
right, weekly, and they were
Yeah.
like 2 hours apiece, and we learned a lot of information. Everything was different, from the birth to during and afterwards, everything was different. So
Yeah.
just
There's
there
so
is a
many
missing link.
scenarios. Yeah. I mean, they taught us about all the techniques we could do and we could use the balls and the bolsters. And I got there and was hooked up to a million things. And they're like, okay, you can't leave the bed until you have the baby. And I was like, okay, cool.
No.
So
Yeah.
then it's hard
Yeah.
when you have one
Yeah.
expectation and then you go in and it's completely different. So even just having that knowledge beforehand, I feel like is super important. And I don't even feel like women get that. So.
No, especially because hospitals are also in the insurance-based industry, and so you have
Mhm.
to kind of think about that too. And another kind of profession that can really help, supplement PTs and make sure, like we're all networked together is there's a lot of amazing doulas,
Mhm.
independent doulas that don't work for a hospital, that can really help bridge the gap with
Yeah.
expectations too. And so I think it's really important for PTs to team up with that because they're such an important, thing for a birth team, and not everybody has one. But I think that they're hugely helpful. So really like a collaborative care between, like PTs, doulas, and midwives are excellent too, because sometimes you kind of have to get out of the regular insurance-based industry to really get that quality care.
Hmm.
Yeah, yeah.
Yeah, and then there's doulas too that will come to your house afterwards, when you have the
Yeah.
child. And yeah, because we were looking into that when I was pregnant, and I was amazed by, yeah, the support that you can receive. That's crazy.
Yeah, that was something that I didn't know either. I just thought that doulas were for, birth and pre-birth, but there's postpartum doulas,
Hmm.
that can be hugely helpful for people now. So it's amazing the kind of support that exists in the world now.
That's really cool.
Yeah, that's so awesome. Yeah, it's such a great field. I don't know. I have a passion for it, and I really didn't truly until I had gone through it, and then was like, oh wow, there's a big need for this.
Mm-hmm.
Because
Yeah.
even as a PT, I felt clueless as to what was going on. So I couldn't imagine how other people who had absolutely, no background of the body felt. So
Yeah.
yeah.
Yeah, I definitely, as I started working with different, all different types of orthopedic diagnoses, I found that there is just a really big missing link in the field of women's health. And so it's something that I did really grow into enjoying and being passionate about because there just really isn't enough support. So,
Yeah, I completely agree.
yeah.
So if anyone wants to get a hold of you, how do you suggest that they do that? What's the easiest way?
Yeah, the easiest way is through Instagram, DM. My handle, StephRavs _ DPT. Pretty good with answering DMs for right now. They can email me too if they want. I'll give out my email usually in a DM. I'm still working on my website and stuff that will have all of my contact information. So within the next couple months, I'll hope to get my website up with different ways to contact me and book consults and discovery calls and stuff like that. But I would say Instagram DM is the best right now.
Awesome.
Okay,
Well, I'll make sure
cool.
to throw that in the description link as well. So if anybody needs to wants to get a hold of you, it'll just be a click away.
Yeah.
So, man, it's been an awesome conversation. You guys
Yeah,
have shed
thanks for
light
getting up
on.
at
Yeah, I really,
or earlier than that.
yeah, it'll get me to the gym earlier, and I have some documentation to do. So, but this
Good
was
for
great,
you.
guys. Yeah,
That's
I enjoyed
awesome.
this conversation.